If you're in the bottom quartile of cardiorespiratory fitness, your all-cause mortality risk is roughly 5 times higher than someone in the elite category. Not 20% higher, not 50% higher, 5 times. That number comes from a cohort of 122,007 adults, and it makes low VO2 max one of the most underpriced risks a high performer carries. The 80-hour workweek isn't what's killing you. The unstructured one is. So here's the minimum effective dose protocol. The smallest set of interventions with the highest return on longevity per hour invested. 3 pillars: exercise, recovery, nutrition. Start with that mortality hierarchy because the specific shape of it matters. The largest single risk reduction doesn't come from going from good to elite. It comes from moving out of the low category into above average. That's the zone where the curve drops sharpest. Going from sedentary to reasonably fit is worth more to your survival than going from fit to elite. For a professional with limited time, that's the most important number in this entire video. Now, cardiorespiratory fitness and grip strength both independently predict mortality. But they're not equal. In the UK Biobank, cardiorespiratory fitness conferred larger risk reductions than grip strength when compared head-to-head. Where it gets interesting is the combination. The highest CRF plus the highest grip strength produced a hazard ratio of 0.53 for all-cause mortality versus the lowest in both. That's not a small signal. The protocol you build needs to train both, not one at the expense of the other. On the cardio side, Zone 2 training, roughly 60 to 70% of max heart rate, drives mitochondrial density through consistent moderate intensity volume. The standard prescription is 3 to 4 sessions per week at 45 to 60 minutes each. For a genuine 80-hour professional, that's often where the protocol falls apart. The data supports HIIT as the higher ROI option per minute. A meta-analysis comparing interval training to moderate continuous training found both significantly increased PGC1 alpha, a key regulator of mitochondrial biogenesis, with no meaningful difference in outcome between them. 30 to 45-minute HIIT sessions per week gets you most of the adaptation at roughly half the time cost. Strength is simpler to dose than most people think. The research converges around 4 to 8 hard sets per major muscle group per session, twice per week, built around compound lifts. That puts you somewhere between 25 and 45 minutes per session. Time efficiency reviews show that supersets, pairing a lower body movement with an upper body pull, for example, cut session duration by roughly 50% while preserving total training volume. 2 full body sessions using supersets, and you're done in under 90 minutes weekly. One benchmark worth doing before you start anything. The sitting rising test: sit cross-legged on the floor and stand back up without using your hands, knees, or forearms. Each assist costs you a point from a score of 10. In a cohort of 4,282 adults aged 46 to 75, 10-year survival was 97% for those who scored a perfect 10, versus 73% for those who scored between 0 and 4. It takes 60 seconds, costs nothing, and predicts both natural and cardiovascular mortality. Take the test now and you'll know exactly which physical quality needs the most work. The full weekly template is 2 full-body strength sessions at 35 to 45 minutes each, plus 2 cardio sessions at 30 to 45 minutes, Zone 2 or HIIT, under 3 hours total. That's the exercise floor. The exercise adaptations from Pillar 1 don't happen during the session. They happen during recovery. So if recovery is compromised, the 3 hours of weekly training you just committed to are producing a fraction of the return they should. Start with sleep, because the data here is cleaner than almost anything else in this protocol. Cognition is optimal at 7 to 8 hours per night. Drop below 6 hours consistently, and executive function, sustained attention, and working memory show measurable degradation across multiple large cohorts. In middle-aged populations specifically, chronic short sleep predicts faster cognitive decline over time, not just next-day fatigue. For a professional whose primary output is judgment and decision quality, that degradation is a direct performance tax. The practical problem is that high-load weeks sometimes compress sleep regardless of intention. That's where the nap data becomes useful. In sleep-deprived young adults, a 20-minute nap produced significantly better reaction time on an incongruent cognitive task compared to no nap, with a p-value of 0.01. A separate study in sleep-deprived adolescents showed significantly greater improvement on a planning domain executive function task after a 20-minute nap, p of 0.04. These aren't large effect sizes, but they're statistically reliable and the cost is 20 minutes. Think of it as a countermeasure on high-load days, not a substitute for the 7 to 8 hour baseline. The sauna is worth adding to this framework if access is available. Finnish cohort data shows that moving from 1 session per week to 3 to 7 sessions per week is the threshold where a statistically significant reduction in all-cause mortality appears. The hazard ratio for high-frequency users versus low-frequency users is 0.84. What makes this particularly relevant here is that the mortality benefit stacks with cardiorespiratory fitness rather than replacing it. So it adds to the exercise protocol, not substitutes for it. Now, the biological age question. Work stress does accelerate epigenetic aging on Grimm age and pheno-age clocks, but the effect size is smaller than most people assume. Roughly 1 to 3 years of age acceleration. More importantly, those associations largely weaken after adjusting for lifestyle factors. One study found that stronger emotion regulation skills eliminated the stress Grimm age link entirely. The data suggests the 80-hour week itself isn't the problem. It's the 80-hour week without the recovery infrastructure around it. Chronic high stress combined with poor sleep, no exercise, and elevated inflammation is what accelerates the clock. Each of those is modifiable. The cortisol management minimum effective dose is simpler than the supplement industry would have you believe. Across studies, 10 to 30 minutes of mindfulness or slow diaphragmatic breathing practiced several times per week is where salivary cortisol reductions consistently appear. A single 15-minute guided deep breathing session produced acute cortisol reductions compared to a control condition in one trial. You don't need an app, a retreat, or a 45-minute protocol. You need a consistent practice of a duration that fits your schedule. Cold water immersion is worth mentioning for what the data actually supports. 2 minutes at 10 degrees Celsius raises plasma norepinephrine by roughly 80%. Within those 2 minutes, that's a well-established sympathetic activation response. The dopamine data is weaker and more protocol-dependent, with results varying across temperature and duration. The norepinephrine response is real and robust. Whether that translates to meaningful performance or mood benefits over time is a separate question the literature hasn't fully answered yet. Nutrition for a time-constrained professional comes down to 3 decisions that actually move outcomes: protein targets, eating window, and anti-inflammatory supplementation. Everything else is optimization at the margins. Protein first, because it underpins the strength adaptation from Pillar 1. To maintain lean mass under normal training conditions, the evidence supports 1.6 to 2.2 grams per kilogram of body weight per day. If you're in a caloric deficit, that ceiling needs to rise. Research in resistance-trained adults dieting under restriction points to 2.2 to 2.6 grams per kilogram as the range where fat-free mass is preserved most reliably. For a 90-kilogram professional, that's 198 to 234 grams of protein daily. It's a high target, and it needs to be a deliberate one. On eating windows, a 4-arm randomized controlled trial compared 12-hour, 14-hour, and 16-hour fasting windows against a normal diet in healthy adults over 8 weeks. Only the 16-hour group produced a statistically significant reduction in body mass, roughly 2.5%, and fat mass, roughly 8.7%. The 12-hour and 14-hour windows produced no significant change in body composition. The practical implication is that for metabolically healthy adults, shorter windows probably don't move the needle. The threshold appears to be at or beyond 16 hours. There's a cognitive angle worth flagging. Early time-restricted eating, meaning an eating window aligned with daylight hours rather than pushed late, improved executive function and white matter integrity in men with metabolic syndrome after 1 month. The cognitive signal is strongest in people who already have some metabolic dysfunction. For genuinely healthy adults, the primary benefit is body composition. On CGMs, the honest cost-benefit here for healthy non-diabetic professionals is a finite 4 to 8 week learning block, not indefinite use. Behavioral change is the documented mechanism. People reduce refined carbohydrate intake, increase post-meal walking, and develop a clearer picture of individual food responses. There's no hard clinical outcome evidence supporting continuous monitoring beyond that window for people with normal metabolic markers. If you're pre-diabetic or have clustering metabolic risk factors, the calculus shifts. For inflammation, the omega-3 dose with the most consistent CRP, Illinois, 6, and TNF-alpha reductions across a systematic review of 96 trials is 1 to 3 grams per day of combined EPA and DHA. Chronic high-stress professionals tend to have elevated baseline inflammation, which is exactly the population where the evidence is strongest. Finally, NMN and NR. Oral supplementation reliably raises blood NAD+ levels. That's consistent across multiple trials. Skeletal muscle intracellular NAD+ is a different story. Multiple biopsy studies show no consistent increase in muscle NAD+ concentration, despite robust blood signals. The blood effect is real. The functional translation to muscle tissue isn't established yet. Consistency beats complexity every time in this data. 3 hours of structured exercise per week, a protein target above 1.6 grams per kilogram, a 16-hour eating window, and a sleep floor of 7 hours. Those are the levers with the strongest evidence per hour invested. If you want the full biomarker testing framework to actually track this, ApoB, VO2 max, grip strength, and the sitting rising test. That's the next video. Subscribe so you don't miss it.